just how much of our resources as a country are going towards specifically this, what we've already defined as an epidemic. Are there investments, are people investing in this condition or this situation?
So they're not investing enough, and that's a across the country problem in public health. And so we talk about it as a cycle of panic and neglect.
Welcome to another episode of Beyond the Scale with Dr. Minera. Today, I'm really excited to have with us April Achter. She is a close friend of mine and also somebody who I've had the pleasure to work with for several years. And we've invited her to give us a little bit of insight into the world of obesity and how it relates to her field of work, which is epidemiology. And she is probably the best person to go ahead and introduce herself and also introduce exactly what she does for a living. So April, thank you so much for being here. I really appreciate it. And I'm so excited to get to talk to you.
Thanks for having me.
Sure.
I am excited to be here. I love to talk about public health and why it's important. And so I am an epidemiologist. A lot of people don't know what that means, but it basically studies patterns of diseases. So who's getting sick and where and when and why, and then what are we going to do about it? So what do we do to either control the spread of a disease or prevent it from occurring in the first place?
Mm-hmm.
I spent 20 years working for the Virginia Department of Health, and that's how we got to know each other.
Yes, that was a good time.
Good times. And now I'm working for Encompass Community Supports as their Director of Communications. They're the Community Services Board locally, so still public health driven agency.
Wonderful. Well, like I said, thanks so much for joining us today. And I want to dive right into, the reason, why we're here, to have a discussion about, public health and how overweight and obesity has become a public health concern. And especially from your perspective. So I'd written a few things here I wanted to, ask you about. Why would obesity or overweight be considered a public health issue or problem?
So when we think about the health of our communities and public health, we look at what's called a baseline. We have an expected level of a condition. And when you have more than that level in a community, you have an epidemic. And when it's global, you have a pandemic.
Mm-hmm, mm-hmm.
And when we talk about obesity, I looked up the numbers and I looked both for Fauquier County, where we live, and I looked at Prince William County, which is where your office is, and I looked at Virginia. And there really aren't significant differences. For all of those places, about 2 out of 3 residents are overweight.
Wow. Yeah, that's a lot. And that's across the board. And what is it nationally? Is it the same thing?
Nationally, I would have to look up for you.
Okay.
I don't know the answer off the top of my head, but I don't have a reason to think that it is much different than what we're seeing here.
Yeah, and I was going to ask you that. One of the things, but what defines an epidemic, right? And I think that's really important because we talk about, the obesity epidemic, the this or that, but there is a true definition of it, and you alluded to that, so that makes sense. We also know that as a public health condition or problem, it's not just the obesity that's the issue, right? Or the being overweight. It's the conditions that it predisposes patients to. And that's why, here, at our practice and in a lot of, medical weight loss practices, it's more than just about, losing weight and looking good and feeling good, in your body. There are some real conditions that we could potentially prevent or at least minimize. So, from your perspective, what are those and what do we see, trending, I would say, as obesity increases?
So 100%. One of the things we do as epidemiologists is look over time. Mm-hmm. And so in the 1900s, up until probably 1960, what was causing our communities to be sick were infections and injury. And now we are at a time where we have 3 behaviors, and I wrote them down there. It's lack of physical activity, mm-hmm. poor diet, and tobacco use that lead to 4 diseases. And those diseases are cancer, heart disease, type 2 diabetes, and lung disease. And that kills more than 50% of our population.
Yeah, it's impressive, and that's, one of the things that, we always struggle to try to get out there. And again, the advocacy of how important it is to manage these conditions, because we see the end results. So it's very easy to say, well, heart disease killed that person or cancer killed that person. But if we look at the root cause, you can attribute obesity as one of the biggest risk factors
And
there.
not just our long-term outcomes when we're talking about, mortality rates, but we also want to focus on people's quality of life. And if you have obesity, then you can struggle from start to finish with everything from self-esteem issues and fitting in seats certain places that you go, to your knees and your back pain, to just how you feel about yourself, to your breathing. I mean, I'm not telling you anything you don't know, but we have to focus on their quality of life as well.
Absolutely. No, and I think that's one of the points, to highlight these issues and realize that, it spans across so much more than just, again, the weight and what we can physically see in a person. There's a lot also emotional strife and, different things that we look at. So yeah, that's a very alarming statistic for sure. So another question we had, for you was, okay, so we recognize that this is a problem, not only locally, but, nationally, locally, maybe even globally. And we are, definitely in a position as a country that we're very advanced and we have a lot of resources. The question, based on, so working, with you and knowing, that you do definitely, you are very involved in policy, creation, grant writing, just how much of our resources as a country are going towards specifically this, what we've already defined as an epidemic. Are there, investments, are people investing in this condition or this situation?
So they're not investing enough. And that's a across the country problem in public health. And so we talk about it as a cycle of panic and neglect. And so when something happens and hits the news, then funding is shifted into public health. And when that goes away, the funding goes away. And so what that means is we have very little resources to invest in prevention over time. And when we talk about our healthcare dollars in the US, we spend 95% of those on direct clinical patient care and 5% on preventing the things in the first place. And we need to shift that balance. The other thing we talk about is we have a health impact pyramid. At the top of that pyramid are clinical interventions and counseling. And the bottom of that pyramid are what are called the social determinants of health, where you eat, where you live, where you pray, where you go to work, all of those things. And so if we really want to change outcomes in our community, we have to invest in the bottom of that pyramid. We have to invest in the things that make people healthy and make the healthy choice the easy choice.
Mm-hmm. And again, alarming numbers, looking at 95 versus 5%. I have to throw the question out there because, a lot of people are always looking at other health systems, outside of our own, Canada, Europe, some other countries. How do we compare, when it comes to prevention as opposed to where they are,
We don't compare well. We spend more on healthcare in our country and our outcomes are significantly worse. We have in our country sort of a privatization of a social safety net, whereas in other countries, you can get preventive care, it's covered. In the United States, health insurance is tied to employment, which is challenging for a lot of folks, and it keeps people in jobs maybe where they're not happy or they have to commute or all these other reasons because they're focused on something other than the work. It's harder, I think, it's hard to compare different health systems, but I think some of the best have what I would call a collaborative approach, in that you aren't being sent from point A to point B to point C from one specialist to the next. The best healthcare systems have strong primary care systems that look at the whole patient.
Yeah. That access is obviously, important as well. And like you're saying, when it's tied to employment, it's a hard, sell for sure. We were talking a little bit, before, going online here about how this situation trickles into other areas, how it affects some other areas. We talked a little bit about national security and some other aspects as well, which I think is really important to highlight, because I think when we're looking at, again, if we're looking at the tip of the iceberg, like, okay, there's obesity and, we need to treat obesity. As we start to look at the trickle down effect, okay, of, other areas that are affected, statistics actually show that there is a huge correlation with disease processes, lost time at work, decreased productivity, everything that comes from being sick, and the American Medical Association does define obesity and being overweight as a disease process, and something that should be addressed. But I think that one of the more, shocking statistics for me was how it affects other areas. And, one example you gave me was about, national security. People may be thinking to themselves, what the heck is he talking about? Would you like to explain for us, please? How does that trickle there?
There's a lot in what you brought up, and part of it is early intervention, right? That children learn from their parents. And so we want the parents to start healthy habits so they learn over time and they grow to be healthy. You talked about how obesity affects the economy. We cannot have a healthy economy without a healthy population. They're so linked together. And when you talk about obesity leading to disease processes that make people have these other conditions, and there's missed time of work, there's also the economic cost of treatment. I think 1 in 7 people in the US have diabetes, and the estimated cost to treat that is $520 billion.
Wow. And that's just diabetes.
That's just diabetes.
Right,
so the cost is astronomical. And 95% of those diabetes cases are type 2, and type 2 diabetes is very closely linked to obesity. Right. And then if we come full circle and we talk about this trickling down to our children, we're at a point where it does impact national security, because 30% of graduating seniors are not eligible to join the military because of their weight. We're cutting off an economic opportunity for a job and a career, and then it's also the impact to their health.
Yeah, that's like I said, I mean, that was a shocking statistic. I'll be honest with you. One of the reasons, it prompted me to sit down and talk to you, because I think that's the kind of information that, is lost in translation. People don't realize, that it goes above and beyond. I mean, who would think that national security could be at risk because we don't have anybody, or we don't have enough candidates qualifying to be able to participate in our military. Has there been, any policy changes? Has there been anything that you're aware of that is, trying to address this issue, particularly with the military, as far as you're aware?
So with the military, I'm not aware of anything that they're doing specifically. I know that nationally there have been campaigns to sort of get America moving and get kids healthy. There have been efforts into school lunch programs. Fauquier County specifically has a really good program, partly funded by the PATH Foundation. Get Fresh, I don't remember the exact name, but it's basically a sort of a farm to table into the school cafeterias, and it's giving kids an opportunity to try different fruits and vegetables maybe they haven't before, presenting them in a way. And anytime you have a group of kids, peer pressure is always great, right? If one does it, then somebody else is going to do it. So it's a really unique, great opportunity to try to make those kids healthier.
Yeah, and that's, to your point, we talked a little bit about that as well. A comprehensive weight loss program or, health program will require that we address nutrition, physical activity. And I think there have been a lot of campaigns, especially with, past governments about, championing physical activity, movement, some of the I recall first ladies, have been big champions of that, as well as, planting your own garden and the fruits and vegetables and stuff like that. We talked a little bit about access to food though. So, for me, it's very easy sometimes to recommend, hey, eat your protein, do this, but, there are some real issues with access to good food sources and supplies, and I think that that's very important and, part of, the public health issue. What is your experience with, the access to food, obviously the cost involved and kind of like the programs that you mentioned that make this more accessible for some people?
I think you're hitting on a really important public health point, which is in a lot of ways, your zip code is a better predictor of health now than your genetic code,
Wow.
right? Where you live so impacts your health. And if you are living under where you have limited resources and you're in an area where maybe you don't have transportation or limited transportation, your grocery store could be the neighborhood convenience store or a 7-Eleven. And there's no fresh food. There's a lot of processed food. There's a lot of sugary drinks, but you simply don't have access to the tools that would help improve your health. And that's why I'm such a big proponent of we have to change our environment to make the healthy choice the easy choice. It's expensive. Fruit, have you seen the cost of berries?
Yeah.
in the grocery
crazy.
store?
Yep.
It's astronomical. And so you're right, it's easy to make a recommendation and sometimes hard for our residents to follow through because of these other factors. Even if your economics are great, a lot of folks that live in our community are commuters. And so if you're in the car for 3 hours a day, by the time you get home, it's hard to think about exercising or cooking a meal.
Yeah.
It's challenging.
Let's be real. Losing weight and getting healthy is confusing. One person says carbs are the enemy. Another says you need to eat more of them. Some say lift heavy. Others say just do cardio. So who's actually right? That's exactly why we're doing this podcast. I'm sitting down with real health professionals, not just in weight loss, but in fitness, recovery, strength, and medicine, to cut through the noise and give you the truth about what actually works. No fads, no gimmicks, just real conversations about getting healthy, staying strong, and feeling your best for life. If you're tired of guesswork and ready for real answers, click the link below and let's start making sense of health together. Very challenging, and I'm glad you bring that point up because I've always tried to work with my patients, right? So that's why it's very important that we that we talk about meeting our patients, meeting people at their reality, all right? So I can't impose on somebody to go work out, although I know that that's what they should be doing, and I know that that's what the data is showing. That's not always possible for a lot of people. So I think that again, highlighting a reality versus a idealistic situation is important. That is the access to food, also economy. So economics plays a huge role, as you were saying. Berries are expensive, so it's easier to just get the packaged fruit with syrup or whatever in a can. And unfortunately, we're dealing with a lot of different variables that we can't always control.
Right. One thing that we do in public health is try to give people little pieces that they can do, right? So if you're a commuter and you're driving in the car, then when you take your break, take a walk. Get up from your desk. Even if you're walking around the hallways, get up and move throughout the day as much as you can. Meal plan or meal prep, because that one reduces your food cost. You've got less food waste, and it's one less decision you have to make when you get home.
Right.
So those are little things that we can try to do to try to help folks move along that journey, which is we're all striving to be healthy. We all can do better. We keep trying every day.
And I love that because one of my mottos has always been progress, not perfection. I think that too many people discount the influence or the advantage of small changes. And so that's really important, and especially with the audience that we are, dealing with right now. Again, commuters going into the city, just don't have a lot of time. I had a conversation with a patient recently, and she's she's starting to go back into work, 2.5 hour commute in, 2.5 hour commute back out. And that's just, I mean, now it's a luxury, to
Right.
hang on to your job, right? So I mean, there is no option. That's what is required. That's what's
Right.
required. And so I think that understanding that there are ways, small ways, to incorporate the different aspects of a healthy lifestyle, small changes add up. So I love that you're advocating for that, because it's hard sometimes to get people to understand that every little bit helps.
Right. And we can't control sort of what's required of us sometimes from our job, but we can make the choice, okay, well, I'm not going to drink sugary drinks. Right. That alone can sometimes have a big impact on someone's health, is cut out the soda or the juice or whatever it is that you've been drinking. We always tell people to shop the perimeter of the grocery store.
Right.
Right. When you go in, you shop the perimeter. If you need something from those inner aisles, you run in, you grab it, and you run right back out.
Yep.
Don't spend time in the middle, because what is in our food is sugar and salt and things that are designed to want us to eat more.
Right.
Right. The food is designed to make us want more. And I think, I had the opportunity to live overseas for a bit. And so for 3 years, I lived in Germany. And when we moved back to this country, I couldn't eat half the food because it tasted so sweet to me. Because they just don't produce food the same way over there. And so even going to a fast food restaurant, which I know is not ideal,
right?
But even
it's an example, though.
The bun tasted like sugar to me. And so my taste buds have adjusted now, sadly, over time. But we have to think about, from a policy level, we have to start advocating that there's no reason to have sugar in bread. Those kinds of things.
Yeah, no, I agree. There are studies, that have been, tried and proven, for decades, showing that if you take a population from a country, for instance, we've seen it in Asian populations, we've seen it, something that's, near and dear to me, Hispanics. If you take them out of their country and they move to the United States, their propensity, for obesity is much higher. So like you were saying, it's not about your genetic code, it's about your zip code. Now, mind you, there are some, genetic issues or predispositions that,
Yes.
would lead you to be more susceptible to having diabetes, and some other chronic disease processes. But again, when you change that environment, that patient's probabilities of developing that disease that depends on the environment is much greater. So yeah,
it's been said that our revenge for Pearl Harbor was McDonald's, right? Because of what happened in Japan when fast food was introduced, their rates of heart disease and obesity and the way that they skyrocketed.
So it's hard to even fathom that, we're about, I would say, 4 or 5 years removed from, the shutdown of the world. And that's where, we had the opportunity, you and I, to really work closely on, during the COVID epidemic. And the reason it was so, I would say, pertinent to what I was doing, because of the weight issue, the obesity epidemic, we knew that, as time went on and as we were seeing people who were being affected by obviously the infection, but also the poor outcomes, it seemed to have a pattern of it's affecting definitely obese patients. Could you touch a little bit on your experience, through that epidemic, which was COVID, and how it really highlighted the other epidemic that we are dealing with now, which is obesity? Even though we knew it, it hadn't come to the forefront, I believe. So I would love for you to tell us a little bit about your experience on that front.
That was good times, wasn't it?
It was crazy. It was crazy.
It was something. I think that, one, I'd be remiss if I didn't say thank you for everything you did for us during COVID and how much you worked with us and the testing and the language. And because COVID hit our Hispanic population early and quickly due to a lot of socioeconomic factors. Folks still had to go to work, living in crowded conditions. And as we went through the pandemic and we learned more and more about the disease process and how people were managing and what was contributing to poor outcomes, two things hands down stood out. Number one was age. Number two was obesity. You were so much more likely to have a poor outcome with COVID if you were overweight than if you had a normal BMI.
Yeah. And I think that was when, kind of like the tipping point, because I've been managing, helping patients manage their weight for many years. And it was at that time that we realized, this is a serious condition, and it's something that we need to look at a little bit, closer. So I remember, you mentioned, the Hispanic population being affected. We know that, there are certain population groups also that have a higher tendency to have obesity. You've mentioned a lot of things, but just to reiterate, is it socioeconomic? Is it lack of access? Is it, sex, male versus female? Is it, race? Where do you see, at least with experience locally and obviously nationally, because you know the numbers, or at least the tendencies. Where do you see this affecting? Where does obesity affect the most?
So I think you've hit on a couple of important points, and one is the greatest predictor of health in this country is money, followed closely by education. And obesity is no different. We know that their rates are higher in Hispanic populations. We know their rates are higher in African American populations compared to white populations. I think that women are probably slightly higher than men, and there are lots of factors that play into that. But there are key differences among the demographics, and in all of our practices, we have to acknowledge those and address them.
I agree. Where do the children stand? I'm very passionate about, education and actually trying to capture, this particular population, the kids, early on, so we can start to form, some better habits. I know that a lot of it has to do with what they observe, what they see. I'm not even going to get on my soapbox about, marketing and how we market to, this particular demographic. It's a huge problem. And unfortunately, a lot of parents, educators, even, physicians are not willing to address the problem in children because there's so much stigma, and also concern that, we're going to not build them up, but tear them down. And I think that, we'd be grossly irresponsible if we didn't address it. Mind you, you have to be tactful, you have to understand, you have to know. That's why I always advocate for education of the people who are going to address this. But what, besides obviously, what we mentioned already, that it's so difficult to recruit, kids coming out of high school, what do the numbers, the stats, or, at least the tendencies that you see show about childhood obesity, longevity, life expectancy, in this group?
So childhood obesity is on the rise. We know it is significantly increasing, and it keeps increasing. And I'm very passionate about this. I have so many thoughts on this. One thing is we need to get kids on their feet again. We need to do that at school because that's where they spend a lot of their time. And it's a common practice in a lot of schools to withhold recess for bad behavior. And my thought is
double punishment, right?
It's double punishment, and children will behave better if they get to move their bodies. I think that we have transitioned to, we actually live in the United States in one of the safest times in history. But from a perspective in a lot of communities, it's very unsafe. So they're fearful of letting their kids do things that we did as children. Right? Letting your kids ride their bike to the store or walk to their friend's house or do these things. And then so much of their entertainment and activity is on a screen. And so the rules in my house, just, to be personal for a moment, is we had always and sometimes foods. So an always food is something that, meets all of our metrics for being nutrition. And then a sometimes food is a treat. These are foods you should have sometimes. We, much to his dismay, had limits on screen time.
Yeah.
And I tried my best with physical activity for years, and it's not his thing. But once I let go, as he's grown and matured, now he does it on his own. So even when you think they're not listening, they are listening a little bit.
Yeah.
That's harder to apply on a population scale because our kids have benefits that some kids don't have. And some kids have come home from school and they're the ones making dinner or taking care of younger siblings, or they have jobs already. I think that where our kids spend the most time is at school. So as much as possible, we want nutritious food in that building. We want them to have the ability to move their bodies during the school day, however that looks, whether it's recess, building activity, in the classrooms. We want to encourage our kids to move their bodies outside of school, even if they can't because sports are expensive. Any kid, there used to be pickup basketball games, and we need to sort of move back in that direction. And it does a couple of things. One is it improves their mental health. It gives them a connection with the other folks in their communities and neighborhood, and it also improves their physical health.
I agree. It's really interesting how, even with my son, he's 14 years old. He'll be out of middle school soon. Really upset because they took, the football program out of middle school. And it just seems that when there is a need to cut, a budget, it's these areas where we're really, missing that opportunity. And you're absolutely right. I mean, we look at where kids spend most of their time, also who is influencing them, so that's why, my wife and I always talk about, how incredibly grateful we are to teachers. Like everything in the world, they're good and bad, but I mean, they really are the ones who are forming, our children. And I feel that, definitely, policy. Is there any active policy to try to integrate this, your thoughts, what you're saying about that physical activity, about, healthy food? I'm not really, up and aware of where we are today with programs that are trying to promote these. I know there are some pilot programs here and there, but it doesn't seem to be the standard. And where are we?
That's the issue, right? Fauquier County is a wealthy county, so they have Fauquier Fresh in their schools, and other counties aren't so fortunate. I think education is facing the same issues that public health faces in that they are underfunded. And I'm with you. I credit my son's good behavior to his teachers. They did such a fabulous job of working with him and inspiring him and getting him where he needed to be. To me, the answer is we have to shift how we spend our money in this country. We have to put an emphasis on health and education. And when you combine those two things, then your localities have some funds available to focus on the things that improve the health, because the school's job is to educate, right? That's their number one role, is to educate these children, and anything else is extra. Yeah. But I still firmly believe you can't educate if your child's hungry and if there's so much pent up energy that they can't sit still and focus. It's all intertwined.
Yeah, I agree. And it's, again, like everything in this, specialty, in this, disease process, as we call it, that we're treating, there's so much more below the surface that, we're not privy to. So, that's incredible. I was, just speaking on children and where we are with that epidemic as well, the obesity epidemic. We're starting to see definitely a decrease now in life expectancy in the children as compared to their parents, which just highlights, what a problem this is. I always tell patients that, and I hate to sound, dramatic, but I'm going to say it, if you're one of the lucky ones, your disease process will kill you. But the majority of people who have a chronic condition become disabled. And so that is a bigger risk, obviously, than death. And a lot of people don't see that. It's like, well, something's going to kill me, sure, but there are more things out there that will disable you, that will not kill you. And then, quality of life. And, I mean,
So
goes without
there's
saying.
a focus now in how we're measuring outcomes, and historically, you're right, it's been mortality rates, but now they're looking at something called DALYs, which are disability adjusted life years, and how an illness or condition impacts, what's the great impact, and on what scale, because we want our years to be good years.
Right.
That's the key.
Yeah, and that's something that I always, again, going back to what we do and what we try to kind of shift the paradigm with our patients coming through the door. They come through the door and they're like, well, I want to lose weight. Once I capture them, it's like, let me help you lose excess body fat, excess unhealthy tissue, so that you can thrive where you are today. So with the limitations of I'm 30, I'm 40, I'm 50, I'm 60. Well, let's thrive, let's be the best we can be at that age, and also the best we can be for the conditions that we have. But yeah, I mean, that's a great, a piece of information there, because I think that historically, like you said, everything's been mortality. It hasn't really been, quality. And it sounds like we're starting to focus more on quality of life. Yeah. Well, this is amazing. I just, first and foremost, I want to thank you so much, April, for taking a chance on us and coming out here and talking about, something that's really near and dear to my heart. Also, because I know you, I know your work so well. I know also your passion for, public health, and really your heart is in it. I wanted you to share, your perspective, which, like I said, may not be something that's mainstream. Right. People are always talking about, some other things that are more obvious, like, what's the newest, weight loss drug? What's the latest and greatest, diet and exercise regimen? But there are some true, real public health implications of being overweight in the obesity epidemic. And I think that the more we highlight this, the better equipped we will be to face it, face the challenges of treating it and helping our patients. So again, I really want to thank you for coming out. This has been incredibly informative. You have no idea how many more questions I have for you, and we may have to bring you out again. So
round two.
Thank you so much. I appreciate you, April.
Thanks for having me.
Absolutely.